It is World Autism Awareness Day. Just last week, we talked about this right here on the show. Startling new numbers from the CDC. Autism diagnoses have been rising steadily over the last decade. We knew that, but listen to these numbers. Now, 1 in 68 children have autism, and for boys, it's 1 in 42. So you hear those numbers and you think, what can you do and what is going on? So Dr. Jared Skowron is a naturopathic physician. He comes in often. He's here to talk more about this morning. Good morning to you.
Hey, Carolee, good to be back.
Okay, so your reaction when you heard those numbers?
It really reflects what we see going on, because usually statistics are a year or two behind the actuality, and we're just seeing more and more and more kids being diagnosed and needing special services in the schools. So, these numbers unfortunately are not a surprise. What we need to do is reverse them and go in the opposite direction.
And that appears to be the question of the hour, right? So people are saying, what do we do? This is something that, has so many different, it presents in so many different ways. There's so much we don't know. There is some information that we do know.
Right.
And it's very specific, right? Everyone seems to have a different situation. So how do you begin treating something like that?
It's really interesting on how we try and treat these different things, because like you said, certain kids have developmental delays in language, some have developmental delays in their social issues, a lot of them are loners, while other kids don't like different sensations. They don't like loud noises, they cover their ears, they don't like to make eye contact with you, and even light touches are painful for them, so they don't like wearing tags in their shirt or socks or shoes, and a lot of them are really picky eaters. So what we eventually see is a lot of these kids only eat carbs, they eat their chicken nuggets, they eat their pasta, and that's it, and we eventually start to get nutrient deficiencies in these children that eventually affect how their brain functions. So it's a vicious cycle.
Right, I was going to say,
that's where we need to intervene on a natural level.
And right, and a lot of people really do want to go that route when it comes to treating autism. What is an option then? I know you've brought something in I'm curious about.
Well, here's a few things that we've actually done clinical trials in our office. So we're trying to test it on kids and put some scientific studies back there. So the three things that we use with most kids, first is a vitamin and protein supplement called Spectrum Awakening that actually boosts the serotonin level and melatonin level inside the kids' brains. And so that helps calm them down, makes them more relaxed, and makes them interact better. Then we have another supplement called Trehalose. This is a really interesting one because it dissolves plaques in the brain. So kids with autism, just like elderly with Alzheimer's, actually develop plaques in the brain. And this is a nutritional product that dissolves those. So it helps them start to learn again. And then, of course, with the elderly, it starts to help retain their memory. And the last one we have is a protein supplement that helps reduce the fight or flight response. A lot of these kids are in their fight or flight. They have really quick fuses. They go into tempers. And that affects how they can learn and how they interact with families, and to help them calm down not only helps the child, but helps as a family as a unit because the child's behaving better.
So this, when it comes to this treatment, there's an autism-Alzheimer's link in terms of the approach.
There really is. And again, the combination between a lot of these neuropsychiatric issues are these plaques that are developing inside the brain. They're called amyloid beta plaques, beta amyloid plaques or alpha amyloid plaques. And I use the metaphor of it's like scar tissue. And so, if you injure one of your joints and it scars together, it's hard to use. So this scar tissue is gluing the neurons in the brain together so that they can't function. But if we dissolve that scar tissue, then the brain can function again.
I mean, that's totally logical. Makes perfect sense. And actually, you're going to be lecturing in Chicago on this, right?
Correct, at the Autism One conference in Chicago this May. And it's great because there's hope. There's something that all parents can do and all families can do because this is reversible.
Right. Well, that's all parents want. They just want hope. And we saw the numbers.
Right.
1 in 68. And 1 in 42 for boys. So if you want more information on this, autism1.org.
Yes.
And thanks for coming in.
Great to be here.
No better day to share this than today. So thanks so much.